While high-risk patients here in Georgia aren't receiving the vaccine just yet, the medical teams who treat them are in order to reduce the risks. Mara Siriani has more on how the vaccine is helping a team dedicated to treating cancer patients.
Atlanta's Cancer Treatment Center of America says it received enough doses to vaccinate all of its employees. It's a process they are overjoyed to begin today. It was all smiles as staff received those first shipments at the hospital in Noonan. In total, the center says it received about 700 doses to vaccinate all of its doctors, nurses, and physicians. Cancer patients are considered one of the most high-risk populations when it comes to COVID-19. In addition, the center reports more than 2/3 of Americans have missed scheduled screenings such as mammograms and colonoscopies in recent months due to the pandemic. They estimate they've conducted 60% fewer breast, colon, and cervical cancer exams from mid-March to mid-June compared to years past. Dr. Jeffrey Metz says the vaccine is a crucial step in saving lives.
Cancer doesn't stop. The disease progresses when it's not getting treated, so they don't have the luxury of waiting until everybody has it right. They have to balance, the life-threatening illness, with care that has to proceed. We were able to put those right in our freezer and work our processes out. We're ready to start giving them to our frontline healthcare workers later today.
And Metz says the center plans to vaccinate all staff members over the coming days and weeks. And in the meantime, he's urging everyone to continue to wear your mask, limit travel, and wash your hands.